Hello, my name is Tonya Winders, and I am the current president of Global Allergy and Airways Patient Platform, an umbrella organization representing over 60 patient advocacy groups from across the world in allergy and airways disease. It's my privilege to be with you today to share a bit about GAAPP's commitment to LATAM. First, a bit about the COPD burden in LATAM. Again, you all know these statistics much better than I, but there are 600 million people currently living across 19 countries with numerous ethnicities that make up LATAM or Latin America. The COPD prevalence in those countries is estimated between 6 and 20% of those over 40 years of age. And again, that's a wide range, but that could be 1 in 20 or 1 in 5, depending on what country in LATAM you're currently residing in. We know that in Latin America, 89% of COPD is underdiagnosed, and that a significant reason for this is the lack of access to quality spirometry. We also know that there are a number of additional risk factors that heighten the prevalence and burden of COPD in LATAM, including a smoking history, being a male, and being over 40 years of age. However, we also recognize that more than 1/3 of COPD patients in Latin America have no smoking history, although there are indicators that many of these patients have a history of tuberculosis or asthma. So COPD and the burden in Latin America is great, and we know that now is the time to actually move this discussion forward about how we can continue as a patient advocacy group and collective voice to raise the prioritization of COPD in policy. So again, when we look across LATAM, care is highly variable. There is a low prevalence of use of smoking cessation programs, and the success of those programs vary from country to country. There's also a very low use of bronchodilators in COPD, so that cornerstone of treatment is often not even accessible or consistently adhered to. Also, a contributing factor are the low rates of influenza vaccination. Again, we know that this lowers that risk of infection each and every year and has to be a key strategy in ensuring quality, consistent COPD care across the region. And we would be remiss in not recognizing the impact of poverty in various countries throughout Latin America. We know that these systemic injustices that result in education gaps, as well as housing gaps, food insecurity, and certainly healthcare gaps must be addressed and prioritized. So as I said, the time is now. How do we raise the collective voice to prioritize COPD in policy and government funding? We need to ensure that there is COPD research funds, that there is workforce development funding, that there is clean air policy, tobacco policy. All of these are key areas that must be addressed from the top down, but it's going to take a bottom-up grassroots approach in order to make this change effective. There needs to be research in all populations, in all countries of Latin America, rather than perhaps just the top 3 or 4 or 5 that oftentimes allocate the priority funding to do so. And then finally, how do we provide a more tailored primary care standardized approach to COPD diagnosis, treatment, and management? If we can prioritize these key things and act now as a collective community, then we can make a difference for the millions of patients that are living with COPD across Latin America. GAAPP stands committed to support this effort, and we again are honored to participate in today's discussion.